Good evening, everybody. Welcome to the March 21st meeting for the Macon County Health Department Board. The time is 5:34, and we will call the meeting to order. Roll call, please.
Mark Scranton.
Here.
Jeff Bender.
Here.
Andy Clevenger. Here. Carolyn Wagner. Here. Jan Hack. Debbie Hill. Dr. Brett Jerger.
Here.
Dr. Menegatti. Cody Parks.
Here.
Dr. Smith. Marsha Webb. Here.
I apologize. Debbie did call me before the meeting, said she was sick and may not be here, so I did hear from her. Okay, if y'all rise and join me in the pledge of allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, approval of agenda topics.
I'll move to approve them.
Second.
We actually, on the agenda, it has to be edited, so we wanted to make note that you guys know that there were people missing in attendance on there. So before we approve it, there has to be that made.
Okay, would you share that with us then?
Oh, my name was missing. It didn't say I was here, that's all.
That's not
For
acceptable.
attendance. I mean, I was here, I promise.
I corrected it in the minutes for you.
That's on the minutes.
But it's corrected on the part that
Oh,
you
on
signed,
the
but not in
minutes,
the
okay. My
packet that
apologies.
everyone's approving.
Okay,
Okay.
So we're back on the agenda topic.
yes, so,
I move to approve.
Cody seconded.
all those in favor?
Aye.
Any opposed? That works. Okay, do we have any public comment for tonight's meeting?
I know we have two.
Okay. Do we have anybody?
Which,
that
Doug
wishes
or
to
Dan,
address
either
the
one of you
board?
can go first.
Dan, go ahead.
Go ahead. I'd like to,
Go up there to the microphone,
Okay.
sir, please, if you would, and then state your name for the record.
hello. I'm Dan DeVore. I want to start off with saying thank you all for letting me be here and having this opportunity to talk. I'm here representing my daughter and my son-in-law. They bought a house last fall out on Cruise Road, and the house did not pass the septic inspection. The septic tank laterals were bad. So they had a contract already signed on this house. They, was in the process of buying it. So they got a hold of their realtor, told their realtor that the laterals had to be put in before they bought the house. So the realtor sends the seller's realtor a letter, about that. So the seller agrees, I will have laterals put in, I will take care of the problem. So I talked to my son-in-law a week later, and he says, well, they're moving forward on the laterals, they're gonna do the laterals. And I said, well, what company, who's putting the laterals in? He said, well, the guy's gonna do it himself. He went down to the health department, and got a permit, he's gonna do his own work. So with concern, I come to the health department, I talked to Brian, and I say, Brian, I got concern here about this guy putting these laterals into the house. I don't feel like he knows what he's doing and is qualified. And besides that, I don't think he ought to be allowed to. Brian explains to me that in the code book, there's a section in there that covers if it's your own dwelling, if you own the house, it's where you sleep, where you reside, or whatever, it's your own dwelling, you're allowed to put your own laterals in. Well, I explained to Brian, it's not the man's dwelling, it's sold. He's moving right now over on this other road, this other address. So, in a sense, it's not his house no more because it's sold and he's moving out of it. And Brian's like, well, we done give him a permit and it's kind of a gray area, but he he owns this house and he owns that house. And I found out that the house he was moving into, a year prior, they give him a permit to do his own lateral work at that house, because that was gonna be his dwelling. So I asked Brian, I said, how many dwellings can one person have? You know, and he said, well, it's his dwelling, we're gonna allow it. And I said, okay. So a few days goes by, I drive by the house, there's a mini excavator sitting in the driveway. It has a contractor's
Sir.
name on it.
Sir, I'm going to ask you to pause for just a moment, Mr. President. The citizen has met their 3 minutes according to the bylaws. It's your discretion whether to allow him to continue commenting for some period of time.
We'll to continue for a brief period, yes.
I can finish my story.
Okay, yes.
Okay, so I go by the house a few days later, there's a mini excavator in the driveway. It's got a contractor's name on it. It says TC All Around Construction on it. So I come back here, I talk to Brian. Again, I say, Brian, over here at this house, the man selling the house is not doing the work. He's hired a contractor to do the work. And on top of that, it's a non-licensed contractor. The contractor doesn't hold an installer's license. And Brian said, well, it's all kind of just a gray area. It'd be all right, it's okay. I said, it ain't okay. You guys should pull that permit, should not let this guy that's not reputable do this job. Well, they did. They let the guy do the job and blah, blah, blah. So now the laterals ain't working at all. They're flooded out, they're junk. And so of course I come to the health department, I called Brian and say, well, I come by and seen Brian. I said, you want to meet me out there and look at this lateral job? Yeah, I'd be glad to. So we drive out there, we look at it, we meet. He sees that it's flooded out, it's a mess, ain't working at all. So Brian says, well, you need to get a hold of the previous homeowner and see if he'll warrant it since it's so new, and get put in and see what kind of warranty he's got on it. And I said, well, as far as I'm concerned, you guys should have liability for it because you're the ones that let all this happen.
Mr. Moore, we'll give you 1 more minute.
1 more minute?
Yes,
Oh, okay, so anyhow, I agreed to call the guy and talk to him. The man told me, he said, no, I ain't giving you no warranty because I pulled a permit issued by the health department. The health department, they come out, inspected it and passed it and said it's a good system and passed it. So anyhow, that's where I'm standing at on the whole matter. And, that's really what I got to say, I guess.
Dan, why do you think the septic system is failing?
It wasn't installed right. Yeah, the guy, I think it's only the second system the guy had ever done, and he didn't know what he was doing. I mean, that's a problem. And Mr. Clifton was never on the job. I brought that up too. The guy that owned the house that they issued the permit for was never on the job. And I asked him when I asked him about a warranty, and he said, oh, there's no warranty. I said, was you on the job ever? And he said, well, no, I wasn't on the job. I worked days. So, the guy never, ever had the first intention of doing the job himself. He
Okay,
hired
Mr.
a
DeFore,
non-licensed
I don't want to
contractor.
cut you off, but we've gone past your time.
Okay,
I would suggest that you put the rest of your comments maybe in writing and submit them to us.
okay.
Okay, thanks for your
All right.
time and.
Thank all of you for hearing me out. I appreciate it. Have a great evening. Thank you.
Thank you.
Okay, do we have anybody else for public comment? Yes, sir.
Hello, my name is Doug Warren. I'm a resident of Decatur, and I'm the Lieutenant Governor for Illinois and Eastern Iowa Kiwanis Club. I'm in a club here. There are 3 clubs in this town, and we've come together with a project that we think would help with literacy if we can, and it's little libraries. We have one in operation right now. It's at the laundromat on North Main, the Pride Cleaner / laundromat. And we're targeting to have 5 up and running by July. We're targeting 12 over the next couple of years. We would stock them, supply them. We have children's books. They would be free. Take one. We'll come and clean the unit. We'll stock the unit. We won't be here every day, so we're trying to set up just the interior, not little libraries out on a post. But we're really targeting this general area. And I would like to present that as a concept to you. I have a write-up, what all we would want, what you would get out of it, and I can pass that along. I have some photographs of what they look like. It's an A-frame design. It's 3 shelves, stands perhaps at the peak, maybe 3.5, 4 foot. We have one library, the children's librarian will come and help sort out the books that we get. We'll buy books, we'll take donations of books, but we'll go through them all before they go out into the various locations. Right now we have one operating at the laundromat north. We have an agreement with the laundromat on El Dorado East. We've been talking with Crossings. We're pretty sure they're going to put one in. And Penny Severance Transportation Hub, we're going to put one in there. The city really wants to have one. So Boys and Girls Club, Macon County Health Department is on our list. So right now, I'm just presenting the concept. I'm not saying let's enter into an agreement or anything this evening, but it would be no cost to you. So hopefully we could put one out in the big clinic area. Kids could access them. I understand you're not having a whole lot of crowds of people at this point, but when you open up, we could have a library there for you. So that's my proposal.
Great, thanks.
All right, I will
Appreciate
pass
that.
out.
Please pass on some more information on that to
Good.
staff.
Yeah, it's one step toward helping. I don't tell you that this is going to answer all literacy problems, but we're making one step.
Thank you.
Good.
Thank you.
Great.
Good.
Thanks for what you're doing on it.
Sure.
Okay, any other public comments? Do you have anything that's been submitted via email or writing or anything?
I do not.
Correspondence, okay. All right, then moving along, approval of previous meeting minutes.
Is this the minutes that need to be, you said you've already updated them? Okay. I would make a motion to approve them.
Second.
All those in favor?
Aye.
Any opposed? Okay. So we have, that covered all of our minutes we have. Board education, we have NA under that, so I'm assuming that Lindsay, you have nothing for communication with the board. Presentation, acceptance of financial report.
Alrighty, so in your package, you have the report for February. We're currently 25% into the year. The fund balance is at 7.77 million. Total revenue is at 1.8, which is 25.6% of what was budgeted. Expenditures are at 1.3 million, which is 19.3% of expenditures. Also, I want to make a note that on the balance sheet, we did split the cash and the money market, so don't be alarmed that the change was so drastic. It's just that when I ran the report, it now moves to a new line, so don't be alarmed about the decrease.
I do have one question on that. So we have the original checking account that we had, and then we have the money market.
Right.
Is there a reason why we don't have everything in the money market? I'm not a guru on this, but I thought when you explained it.
John didn't recommend it. He said we should leave some money that's readily available
Gotcha, okay.
for things as we need to fund and things like that. And there is a limit on that, and also because of that, there's a
7
limit on that
withdrawals.
money market. You can only do, I think it's like,
7.
I think it's five.
Five,
It's 5
okay.
per month or whatever.
Okay.
So he didn't recommend putting all of it in there at the time, which brings up another question. Do we have anything in here with a interest to date, Lakia?
Oh, it should be on here.
The
If you go on the
opposite
next
page, and
yeah.
it's a fiscal year folder.
Okay, is that under interesting?
Yeah.
There's
12,000.
12,200.
That's what was,
No, oh, that's
the
budget, sorry.
numbers, the 2007.
2,761. What is our fiscal year it ends when?
Which one? So we run on the state, the county, and
For
federal.
this,
So the county one is from December 1st to November 30th. But most of our grants fall under state, so that will be July 1st to June 30th. But this is for
as far as
December,
this is concerned,
December,
this
November.
started in December.
December 1.
Okay, thank you.
That's when it's supposed to start. That's not when the money goes.
That's when this,
Start.
that's when this started, though, no.
Yeah,
Okay.
so we've got how much to date on that then?
$2,761.
Okay. That doesn't sound right. John had told me a lot, I remember
I
that.
need
a
to-
while back.
That's what I
Right,
was
now that you say that, I do need to,
questioning.
because I think that's not for the money.
No, that's not for the money market.
Because we did put in 4, right?
Yes.
So then it would be $4,273.97. That's the number, I'm telling, oh, $4,273.97 is the number of money accrued on the money market.
Really?
4,000 what?
$4,273.97.
Is that someplace that I missed on here?
It's just the
Well, I just did the
difference.
math between what we put in and what's in there now.
Okay, got you, okay.
And it's been drawing interest since when?
I don't know the exact date, it was after the first of the year.
Yeah. There was some kind of January when they created it.
Brandy was supposed to move it after the board voted to move it, and I found out, I talked to Mr. Jackson, it had never been done, because it wasn't communicated to him to go ahead and do that, even though the board had discussed it and voted to get that done. So that's when he took care of getting it moved, so we lost about 3 months on the money, roughly. Just for the sake of information in regards to that. Okay, any other questions on that for Lakia? Yeah, motion to accept the financial report is presented.
So moved.
Second. All those in favor?
Aye.
Any opposed? Review and approval of department expenditures. Anybody have any questions on that? I have more than 3 of those.
I know, I have a question. Forgive me if I'm not. Do we own vehicles? What do we own?
4 Ford Focuses, Explorer, and then a van. So 6 cars total.
Wow,
4 of them for environmental, then 2 for the health department's use.
4 environmental uses,
Yeah.
okay,
And then the other 2,
2, okay. So when we're seeing mileage on these reimbursements,
that's for personal vehicle use.
is there a reason why they're not using the ones we own?
It can be a number of reasons, like, I couldn't, I guess, identify exactly on this, but just to kind of give you some insight, like if someone's traveling from home, sometimes they'll take their personal vehicle, depending on like the direction that they're going. If it's out of their way to come by the health department to pick up a health department vehicle, we'll just say, you can go from home, depending on where they live. People who live local in Macon County, we do encourage them to use the health department vehicles. But that's just one reason that someone could have a personal vehicle use.
Well, I'm just thinking if we own these vehicles,
So technically, we only have 2 for the health department.
2 for the health
Yeah.
department, yeah, and I don't
People
know,
use them for like home visits,
home
things like
visits,
that.
yeah. So are these other 2 used at all?
I just used it today.
Yeah, she used it today for a conference.
Drive them out.
Conference, okay, okay. I was just curious, and the only reason I thought about that, because I see oil change and filter, and I was like, oh,
That's
look
where
at it.
the
Okay,
focus is in the.
Okay.
We have, yeah,
okay, thank you.
not personal.
What happens on that if they get wrecked in a personal vehicle during work time? Like if I work somewhere, we drove our personal vehicle and got paid mileage. How's that work if they got in a wreck?
So obviously they would want to contact their director, administrator, assistant administrator immediately so that we could, I think that we are supposed to go to the scene and meet the employee at the scene, you know, for then the regular process to take place, the call and insurance and all of that. As far as like, which specific part, sorry, so I can make sure I answer your question.
I guess you kind of did. It was just a question. I mean, as far as, is there some, I mean,
It is,
I
yeah.
work at Vote on if we drove a personal vehicle anywhere,
Mhm.
and it was during work hours, there was a whole protocol, I mean, I'm not saying, I'm just saying it was a whole mess. I was
Yeah,
curious.
that's what I'm.
Yeah, we have
Yeah,
that
that's
as
what
well.
happens, yeah,
I
we
was
have to
gonna
do a
ask
whole
Mike,
incident
what
report,
kind
go
of
to
legal
the
liabilities or
hospital.
obligations do we have if somebody's using a personal vehicle for department business?
No, I mean, if they're doing something for the health department, legitimately so, if they're operating as an employee and performing a work function and are involved in a crash during their work hours, we're going to have exposure in terms of liability, the county will.
But the county has insurance would cover a non-governmental vehicle
Yes, to some degree.
Okay.
We
to a
have,
certain extent, yeah.
we have insurance when it comes to torts committed by county's employees. In terms of the automobile insurance, there's going to be some issue in terms of subrogation between the employee's personal policy and the county's policy, but that would be something that the insurers
Sure.
would work out. But in terms of liability, the county is generally going to have some exposure in that scenario.
Do any other departments have a mixture like that of owned
Most,
and non-owned?
I would say most. I know that, I don't know necessarily how the health department rules factor in, because obviously you have an incredibly large workforce compared to most county offices. But the auditor's office does, as a general rule, require submission of proof of legally being able to drive, so a driver's license, as well as proof of insurance on the vehicle being used before they will authorize reimbursement for mileage expenses.
And
If
that's
you're
what I
using
see
your
that.
car
Yeah.
for expenses, so
Okay.
it doesn't surprise me that the health department would have policies in place to address that.
Do you,
But, yeah.
Do we have
do you run, yearly? Is that what you're saying? You run a yearly, driver's report?
Motor vehicle,
Yeah, okay, thank you.
and they have to present that before they're even hired.
And if someone hasn't turned in their insurance, they'll just get like a general email from HR that just says, hey, you haven't turned in your insurance, it's expired, you cannot drive on the job until we receive an updated insurance card. So Susan does a really good job staying on top of that.
So we have policies.
Yes.
Okay. All right, any other questions for Lakia on the expenditures?
What was the ad campaign that we have listed here, the outdoor media or media outdoor for 1,200?
So that falls under Karen's program for, is this BBO or is this Better Birth? For Better Birth Outcomes, it's the billboard. you
A
see.
billboard, okay, okay, great, thank you.
Okay, anything else?
One more,
Okay.
sorry. Under Sage, the payee is Sage. And it has down here check reissue.
Yeah.
What does that?
So we paid them back in August, October, and they said that they didn't receive it. So what I have to do is I contact downtown, the county building, and I ask them, has this check cleared? They told me yes or no, they said the check hadn't cleared, so we put a stop pay because it's been 6 months,
Got
and then I reissued the check.
Got you. And what is Sage Care Training?
It's a training that we need for our senior services division through a grant, and it's a diversity type of training.
It's for your employees.
It's for the employees, yes, a training for the employees required by a grant and funded by a grant, so it's paid for by a grant that we
Gotcha.
receive.
Thank you, thank you.
Okay. Anything else for Lakia on the expenditures? Motion to approve.
I second it.
All those in favor?
Aye.
Any opposed? Okay, grant applications for review. You have none?
We have none that have been like approved, but we are working on completing a grant application that's due tomorrow.
Okay.
And that will run through December of 2024, or I'm sorry, December of 2023. So we'll submit that tomorrow and that will be, we'll give you guys an update next month, or if there's a meeting before then, if that grant is awarded to us. It's a COVID-19 vaccination grant. Yes.
Okay, department division reports. Anybody have any questions on those? Or does anybody from staff have any comments they want to make on the reports at all?
Yes.
Okay,
Okay, I may have misunderstood, so I'm just asking. I was under the impression that the emergency preparedness had been moved out from under environmental. Is that the case, or was that a misunderstanding?
I don't think that's taking place. I mean, there's been discussion about, since their job posting, or the job has become open again, about changing the criteria for that job,
Okay.
if I'm correct.
Yes, and Kathy has drafted an updated job description that I just need to email to you guys if you want to review it, or we can move forward with posting it. But it does just kind of talk about the changes that Marcia and Mark and I had discussed, about the criteria to be eligible for the position. So I will send that to you guys tomorrow.
Yeah, just for the sake of looking at it and saying, yeah, it's good, go ahead. Okay.
I have a couple of questions. Under nursing, what hours do we have child immunization clinics? Are they set? Or is it a walk-in, or?
So it is, clinic runs on Tuesdays and Thursdays from 8:30 to 11:30 for the morning clinic, and then 1 to 3:30 for the afternoon clinic. We do a Wednesday morning clinic from 8:30 to 11:30, and then we also do we call it Baby Monday. So we do an afternoon once a month that's reserved for babies under ages 2. And then we do a kind of an extra Friday just to give some additional hours that might work better for people's schedule once a month as well. That's our standard hours.
Okay.
When we get closer to back to school time, we will add more days.
Yeah.
We'll do things like backpack attack and kind of add some additional resources.
I was asked to add, this was brought up to me as a concern that whether or not we had enough flexibility with our hours for childhood immunizations for parents that are working. And I just wanted to know, will we issue appointments if somebody, and if so, how late could that appointment be?
We do, right now, we try to run by appointments as much as we can. Once it gets back to school time, if we have room on our calendar, we're taking walk-ins just because the need is there.
Sure.
The last appointment for the day is at 3:30, unless we're doing some kind of a specialty clinic, because as you know, our hours are 8 to 4. Again, with back to school, we will run specialty clinics. We're trying to work on getting the ability to go off-site this year. For back to school time. It's a very labor intensive process, so we're working on that. But yeah, we'll offer some additional hours and kind of off hour type things specifically for that back to school time period. We don't generally do that right now because we have so much availability that it doesn't really warrant.
You haven't had any complaints from anybody?
No, the only time we get complaints is around October 15th,
Yeah.
when the cutoff date has came and it is now at an emergency state. And we do, even in that situation, even though we've been open all year round, even though we've been advertising all year round, we still try to accommodate to the best of our ability during that situation.
Made me think of something that just promptly went out of my brain. Okay, I think you've told me that they could get help if they needed it, okay.
And really quickly, I'll say too, nursing and Rachel and Amber, they
We've already started talking with the Y about their backpack attack and how we can funnel people here. And we'll be doing advertising because one of the things that we found was that sometimes people don't know what immunizations their child needs. So we're gonna start that early and often and.
Yes.
Yeah.
And we're working with Lori Frame with DPS, she's their head nurse to try to get, we've already gotten information out to the kids
Right.
now that need vaccines next year. So we're trying to do as much, information sharing ahead of time that we possibly can.
Perfect. And one last question. Your medical, you call it medical reserve, what do you call it?
Medical Reserve Corps, that's happy.
That's it. I just couldn't think of the acronym. Do you utilize them to help you with school, the crunch?
We haven't, we did utilize them a lot during some of our COVID-19,
Right.
but we haven't utilized them for school stuff.
Okay.
Not saying we can, but we just
Sure.
haven't.
And about how many people do you have on that? Just ballpark?
I think somewhere between 30 and 40. Now,
Okay.
whether or not they're still active is another
Sure.
question.
Mostly nurses?
Yeah.
No, not.
Right, because that's the hang up too, are they able to give a vaccine?
They're not mostly nurses.
Not anymore, they're not.
Okay, well, I think we could maybe help you with recruitment. Okay, thank you.
One thing I will say, since that's up, if we do get more nurses, I'd love to get them on site for some training. VFC is a hard program for them to jump in. With COVID, it's one shot, you know where it's going, you're getting it done.
Sure.
With VFC, there's so many intricate details to that
Yes.
we would need to onboard
Of
train
course
them,
you
which
would.
we'd be happy to do if we had.
Oh, one last
Staff.
question I will be asked. Would you cover liability insurance? Are they covered from a liability standpoint? These are retired people that are coming in and volunteering their time
For MRC or in general?
for giving immunizations, if they're gonna help you with immunizations. That's a question we need to, be thinking of and answering.
That I don't know, because
So
they're
you need to
volunteers
talk-
through us.
Need to talk to your, whoever your liability carrier is. We need to check
This
with
has
that.
been brought up in the past, and there is a level of liability insurance, but I could not quote it. I wouldn't be comfortable speaking to it, but we do have them complete all of our volunteer paperwork forms that
Okay.
state. So if we read the details of that, it might give us a little more information.
Yep.
We can look into it for
Just be
sure.
able to answer that question,
Sure.
because that's gonna be a big one for people that are thinking of doing that.
Or let's move on under something we're coming up to, because I have a question on it.
Yeah.
Okay. Okay.
So, I know this probably isn't a good fit, but since Rachel's been talking, do you have anything to update us for under your department conversation with status of the mental health?
So I have
Situation.
not heard of anything beyond what you and I have already discussed with them, that Crossing is not gonna take patients inpatient, they're only gonna do outpatient basis. I have been speaking with Genova Pharmacy a little bit to find out, are patients getting the medications that they need? Is that getting handled appropriately? So I've reached out to their kind of lead pharmacist that works under the behavioral to try to get some more information from her, look to set up a meeting with her. So I have that on my agenda. But other than that, I don't really have, I don't know how we can create an in-house program for people. That is the answer. They need somewhere to go and do inpatient. And I do not have an answer for that. I wish I did. If there's something I've not thought of, please, by all means.
Yeah, I don't expect the health department to create a program to service this needy community, but I think the health department should definitely have a role in conversations with other community partners like Heritage and Crossing and the hospitals, because I've already been hearing a lot out on the street. There's a lot of people very, very concerned and even stressed out. I just talked to an individual over the weekend, and they are like frantic about what the options are gonna be down the road.
They get shipped out.
And
Yeah.
it's gonna get worse, and that gets all tied into the conversation I was involved with last week about the ambulance service we have here in town. There's gonna be, I think, I don't wanna say a tsunami, but there's gonna be some catastrophic things that are gonna happen in the next 6 months to 2 years here in Macon County in regards to how we're handling our health situations. Dr. Smith is shaking his head, because I know he knows too, and I'm sure Dr. Durgan does as well. But, I mean, I'm on the outside looking in. We went to a meeting last week, I won't get too far off the base here, but I went to a meeting last week where Mount Zion's trying to start an ambulance service, and they're kind of educating the community. And I listened to the guy speak from the ambulance service we have right now. And I don't know if you guys all realize this, but our ambulance service right now in Macon County doesn't have a contract with anybody. They have a license from the city of Decatur to operate. If these people decide that some bean counter somewhere says, hey, we're not making money in Decatur, Illinois, they send the city a letter, 30-day notice we're vacating, we could be without an ambulance service. So all these things are gonna get taxed, and the mental health thing, we're already seeing it. Marcia told me one day, they had 2 units out of 5 out of town, one going to, Peoria, Chicago, another one going to Indianapolis.
They had 3 units out. One was going to
Out of
Northern.
five ambulances.
And these were all psychiatric transfers. One went to Indy, one went to
I thought you said Peoria, Chicago.
Chicago, and one went to Northern Michigan.
Well, I have a question.
From Decatur, Northern
So I won't
Michigan.
get too far off base on this,
No,
but
I'm not gonna get too far off base, but what happened to the request to be heard in a hearing? Did that get put through?
they're
The
gonna notify when they're gonna have public hearings.
No, that's been posted. You had a deadline.
No, I'm saying they're gonna notify the public when they're going to conduct the hearings. There's not a date that's set in for it.
No, I think.
You got a date to submit the
Yeah.
request,
Yeah.
but they haven't responded back to
Has
say,
anybody submitted a request?
yes, I
Okay.
know several people that have.
Okay.
But they have not had a response yet as to
Okay.
when that's gonna take
Okay.
place. It has to happen sometime prior to the June
Yes.
deadline. June
Yes, it
deadline.
does. But they've already gone ahead and emptied their adolescent psych unit.
Yeah.
It's empty.
But it's gonna be a problem, and I don't know, Dr. Smith, you got some thoughts on this?
Well, about the ambulance service, we had an incident yesterday at the surgical center, which is not a direct part of the hospital, where a patient was dropped onto the floor as they were waking up from anesthesia. And so we had to transfer the patient from the facility to the ER. And I stepped in and said, you call the ambulance, because this was the procedure we had when I owned it, and say, you call the ambulance service, they'll come pick up the patient and they'll take him to the ER, because you don't want the liability of your nurses hauling that patient to the hospital. Took them half an hour to finally contact somebody after calling, and then they were told there was a 3-hour wait,
Oh.
because there was only 2 ambulances in Decatur.
They're on,
And they were sending them to a dispatch in St. Louis to help manage the situation. It was nuts.
Yeah.
I mean, if you're a patient and you're having chest pain and you're at home and you wait more than a half hour, you probably are gonna be dead.
Yeah.
yes,
It's a real serious concern in this community.
The
They
health
just lost
department
2
started
more
fixing a lot of
medics this
CPR classes.
Yeah.
did you know that?
What's that?
They just lost 2 more medics this week
On the ambulance service.
on the ambulance service, so that equates to 1 crew, 1 ambulance
Yeah.
every 3
Yeah.
days.
So I think I wanna wrap this up to move on, but anyway, so Rachel, thanks for the update on that, but for the sake of the rest of the board, I know we touched base on this last month, but we really need to look at what we're doing and what the health department's role, and to some extent, even responsibility of the community is to be involved and engaged in conversations with people in the community, whether it's the leadership of the city or the county board or whoever. We need to have a lot of conversations, and I don't have a problem. I don't like creating more governmental bodies, but if it's so warranted, you know, I would entertain that we consider, you know, either members of the health department staff or even maybe 1 or 2 people from the board even, that we partner up with the other people in the community and get some kind of community organization committee going, because I'm telling you right now, I know what Marcia's background is. I got 14 years as a medic and as a firefighter, there's a lot of people out there in the community, I can tell you right now, that have more of an inside knowledge about how some of these things work. I tell you what, I'm really worried right now. So I can't even imagine what the average person, as Dr. Smith alluded to, that's sitting at home and they think somebody's having a heart attack or whatever, but the mental health aspects is what's really got me worried, because I've talked to somebody already in the community that said we have a mental health facility, it's called jail. And I thought they were
They're
just
not
joking
equipped for
about it,
that.
they were very serious about it, said, this is gonna be our only option down the road. We won't have any other alternatives.
Right.
So I'm very, very fearful. There's a lot of kids in schools, I know teachers are seeing it, principals see it. We all know somebody that's had to deal with mental health situations, whether it's, suicide or whatever. I'm very, very concerned about the overall health, if you will, of the people in our community. And I think that should be one of our responsibilities as a board to at least shed some light on it, perhaps come up with some ideas about how we can, as an organization, be involved and maybe take a lead, if nothing else, in conversations and get this started, because I don't think there's that much being done right now. For the people I've talked to so far, there are certain things being done by individuals, but I think as a community, we're not really at the point where we're really doing that much yet. And I think it's something to think about, but the stuff as far as the mental health goes, I'm very, very concerned about that, because we need to have a place for people to be able to go that need care, especially people who want to go someplace voluntarily. I would hate to think that we have to find out that somebody took their own life because they felt that was their only option, because there's nobody here in Macon County to help them. And I think that's very, very sad, and I think it'll be a really dark day if we fail to act and do something moving forward. So I'm open to ideas. I would love to get involved in it myself to a certain degree, because I know some people that have been affected by this. I've had some people that have had relationships over the years that have made some not great choices, and I hate to see anybody go through that. And I think there's more of a need now than there has been. And I would challenge everybody to give that some thought and some consideration, maybe come back next month with some ideas.
Can I say real quick, there is a
Sure.
community mental health board. Didn't you go to that meeting, Lindsay? Maybe you could speak on that.
Yes.
Brandy had mentioned that before, but I haven't heard. I've
I'm
never
not
heard
privy
anything
to
about
that
it.
invitation, but I would be happy to go if I'm able to.
So there's something that Heritage does, and it's called Community Together, and it's ran by Jessica Smiley. And it's kind of a 3-tiered mental health program, where the first tier is focusing on early intervention and prevention. The second tier is outpatient and school-based services. And then the third tier is like in more intensive support for those struggling with mental health. It serves our community here in Macon County as well as DeWitt County. And they currently partner with our agency. I attend their meetings, which I've only attended one because they just happen once a month. So they partner with Crossing, United Way, Big Brother, Big Sister, SIU School of Medicine, CASA, Decatur Public Schools. They have HSHS St. Mary's Hospital, which might be outdated at this point, but they partner with all sorts of agencies in the community. And they have different types of meetings. I mean, they have executive meetings that are more of the officials from those agencies, and they also have meetings with individuals in the community that are interested on focusing on mental health advocacy. So they have, different trainings that they provide. One of them is called Ending the Silence training. There's a mental health first aid trainings that I know that some of our staff in our agency have done before. Like caregiver connections group for those that are caring for somebody who struggles with mental health. So they offer a lot of different things in our community, but of course it doesn't replace the inpatient care that we've lost.
And the focus is mostly on children.
What was that?
Especially
Yes.
on children.
Yeah, that's what I was gonna say.
Yes.
The mental health board is probably the one that should be,
Yeah.
should be pushing that through from the mental health perspective. And I do know that when I knew about the situation before I left Heritage with St. Mary's. Yeah. And at that point, there was conversations between St. Mary's, Heritage Crossing, you know, those leaders were getting together. And even before that happened in St. Mary's, we were working with a group in, through the mental health board was leading the group to try to address the emergency psychiatric services, the ones that have committed, and trying to figure out what to do about that, because of taxing the ambulance services and things like that for the people who don't want to be, you know, it's involuntary.
Yeah,
And the fact that people were ending up either in jail or ending up in the emergency rooms and then getting medications and then just then let go. That is just a repeat
Right.
cycle.
yeah,
So
just
that's,
a rolling
so
door.
we had a, and the police department was with us and, you know, there's a group of, you know, the community leaders that will work on that when I left. And
The biggest problem now is we're not gonna have any patient services because there's no place for them to go in terms of facilities that will have beds.
Because an ER can only hold them, how many hours?
Well,
I think that
actually,
changed.
yeah, they don't hold until there's something supposed to be.
Up to
Yeah,
a
but
week.
they've got, like, there's a max on that they can hold.
And there's so many ER safe, like, rooms, you know what I mean? Like at St. Mary's, we redid a couple rooms in ED just to ensure safety for behavioral health patients, but there's only so many rooms they can accommodate a whole like that.
I know somebody recently, that child took to their, they didn't have any rooms there for them, stayed in an emergency room for 3 days. And then they finally transferred them, and they took them to Indianapolis.
Mhm.
That's not good.
There is some
Anyway.
placement in Springfield right now, but, yeah, but if you have any connections for that mental health board, I would be happy to reach out to them. If you have any contacts.
Okay.
I do.
Tim Atkins, who it is. Tim
Okay.
Atkins, yeah.
Well, moving on, thanks everybody for the thoughts on that. Keep that in your thoughts and prayers, and maybe we can continue that conversation, because I really fear for where we're headed here as a community with not only the physical, but mental health, well-being of people here. Okay, employee recognition, March anniversaries, Maria Kohler, 5 years, Jamie Smith, 5 years, Terry Luckenbill, 2 years, and Kim Otis, 1 year. Thanks to those for their service. Okay, old business. Discussing status of employee retention bonus program proposal. So I will lead this conversation off of what I found out that happened since the county board meeting last month, or earlier this month, I guess. So my understanding, Jeff, you were there, so you can chime in as well. The proposal was approved by the board here last month to be sent forward to the county board for merely just kind of giving their blessing on us, making a change to our budget. And for whatever reason, they got a little bit deeper into the subject and started dissecting this apart. And the next thing you know, there's a lot of people that are kind of having some real concerns about this whole concept and everything. I've talked to the chairman, a couple of other county board members since then, and reviewed this stuff. I know Lindsay had been working on a plan with Lakia. It sounds like to me the county board's biggest concerns were this just kind of came out of nowhere. They're looking at, okay, so you guys got money, we're over here, we're struggling with these other departments, so we got all these other things. So once I had conversation with people and said, look, here's a couple things you need to understand. We're struggling to retain people right now. We're trying to come up with some outside the box thinking about how to do this. We've discussed this for about 3 months. We've worked on this, and this is what we came up. The board unanimously voted in favor of this plan, and it's going to be more money in the first year just because it's a startup. So there's a lot more payout that's going to exist, but we anticipate this won't be a strain on the budget. It'll be a budget item that we will incorporate into our financial planning for our budget for next year. We're just admitting the budget, not right now for this year. And my hope is that by doing a responsible thing, by taking this money that we have that wasn't doing anything, and by putting that money to work for us, that we will therefore create a platform to fund some of the projects we'd like to fund that we might not otherwise have money for. And this is, in my mind, one of the things will be more fun, because if you take $4 million at 3.5% interest over the course of the year, you can do the math and figure out what we could anticipate getting out of that if it's managed properly. And I trust the treasurer will do his due diligence to overwatch that money and take care of it for us. So we will have the money and the means to fund this for an extended period of time. But I had asked Lakia and Lindsay if they would sit down and put together a 5-year projection for not only the benefit of the board, but also for the benefit of the county board, so they can understand that we had gone through this process, we've had the discussion, and put a little bit more details and specificity to the questions that were being raised by county board members, to give them a better understanding of what we're doing and how we're going about doing it to fund it. I think once they see that information presented back in front of them again, I don't believe that they'll have any real concerns about it, and I don't anticipate any objections on this going through next month. But I apologize to the staff and everyone for this being held up, because I saw no reason for this not to move forward, and obviously it's created another delay for another month, but we'll deal with that when we get through this. I don't know, Jeff, what's your impressions? You got anything different to add to that?
Maybe just some more detailed points. Councilman, Board Member Bill Oliver asked to table the motion for discussion in the last county board meeting. There was also discussion in caucus about tabling it. And my comment was, if there was a need to table it, I was comfortable with presenting all the details so that everybody would understand the program and feel good about what they're voting for. So I think we lost a month for education purposes, and we'll get through it. To Mark's point, I'm pretty confident that it'll be fine, and it'll pass next month.
What is our deadline for the $25,000 in grant money that was allocated to this program?
June 30th.
Oh, good.
Yeah, so we're still safe.
Okay, good.
Yeah.
Yeah, we've got a couple months still on that.
Okay, good.
Yeah.
Okay,
Thank you.
anything else? We just wanted to update the board, let everybody kind of know what had happened since we passed that last month. Okay, discussion regarding dental update as discussed in February 21st meeting.
That was just regarding, I know we had heard from Kim about potentially getting back into the hospitals. I didn't know if there was any further discussion on that, or if there anything further had happened.
We had played phone tag on doing that, so
Okay,
we're supposed to hopefully have a meeting set up here the next week to be able to go into detail on it.
Do
okay.
you think that's something we'll have either update or clarification on by next month? You think?
Yes.
Dr. Curry? Okay, thanks.
Thank you.
Okay, discussion regarding salary assessment discussed February 21st Board of Health meeting.
That was regarding, I know you had mentioned doing some kind of an official salary assessment, and I didn't know if there was any other thoughts on that, any companies specifically that I should be looking into?
I don't know, I was going to have to just, what I did mention was to try the Illinois Primary Healthcare Association and talk with somebody in the administration, tell them you're interested, or also talk to other health department administrators that you're, now meeting, and ask if their county has done such an evaluation, and if so, what HR firms did they use? Because we obviously want somebody who has working knowledge of how to do a good comparison for the area and for the work that you do.
Right.
So we may have to spend some time finding the right people, but we don't wanna, wait forever, but we also don't wanna rush in with somebody who's not really equipped to do the job. So I appreciate that, if there's any phone calls I can make for you or you need, let me know.
Okay, yep, so I'll give you guys an update. I'll try to reach out to the Illinois Primary Healthcare Association and see what kind of progress I can make there. I also, there's a kind of like a conversation thread from other administrators in the surrounding areas, so I can kind of throw that out as well and try to get some feedback on their salaries and their assessments that they've done, and give you guys an update on that next month.
We were given a few months ago a little bit of information from Brandy and Bethany, but it was more of a self-reporting that they had put it out there for all health departments to sort of fill out a questionnaire. You know, I know as a nurse practitioner, I'll get these things. What's your salary? We're trying to do. Well, I was hoping for something a little bit more formal from a company that can go dig up that information and put it forth rather than just a self-reported piece of information.
Okay. Yeah, I'll definitely look into that. I mean, I know one way that we often will, learn of salaries in neighboring communities is just simply from job postings where they have the salaries posted, but it can be difficult just because other health departments may function different than ours, and a position here may not, they may do different things in a different agency, so I'll definitely look into, trying to find out if there is some kind of formal evaluation method that I can give you guys an update next time.
Yeah, that would be great. And then going with a company, I was hoping they would help us more for ranges, to know what to do when someone topped out at the range. Because we don't want to get to that point where they just keep getting higher and higher, and then now you've got this big giant, you know what I'm saying? This giant big step between your new hire and somebody who's been here 20 years.
Right.
So we need to understand that and address it.
And that's something we definitely need to work towards, because before you know it, we'll be sitting here talking about planning budget for next year, and it would be really advantageous to have that information well in advance of that, so we don't have to sit and dissect that at the time when we're trying to plan the budget. So that would definitely be helpful. So if you come up with some guidance or whatever from some of the organizations, that'd be great.
Okay.
Get back with us on that by next month if possible.
Yep, I can do that.
Okay, all right,
Sounds
thank
good.
you. Okay, new business,
Mr. Chairman,
yes.
I have something we could discuss, but we cannot take action on it tonight.
Okay.
Is anyone familiar with the consent calendar? Okay, Mr. Baggett, I may need your backup on this.
Okay.
Okay, so if you look at our agenda here, you can incorporate things that are not typically controversial into just one big vote. It doesn't mean you can't discuss it, but it would really streamline us getting to the actual old business, new business. So we could basically, help me out here, take approval of previous minutes all the way through department division reports. And do we approve the consent calendar? Do I have a motion? Yes. Second? Yes. Vote, boo, we're done.
And one minor clarification, correction.
Thank you.
With a consent calendar, the idea is that there would be no discussion generally. If there's going to be discussion, you would remove a particular item from the consent calendar, discuss it, and vote on it separately. But the consent calendar is brought up as a motion to pass a consent calendar. Second, there really isn't any discussion of the individual items on the consent calendar. That's the entire point. It's basically the body's ability to pass something by unanimous consent and without further discussion. If there's a need for or desire for discussion or an individual vote on anything, any particular board member has the ability to ask for any item on the consent calendar to be taken off the consent calendar, considered on its own. That's not subject to appeal or debate. So if anyone wants to talk about something, it's their own personal, issue, they can just ask for it to be removed from the consent calendar, and it has to be removed from the consent calendar.
For that one meeting.
For that meeting.
Yes.
Prior to the vote.
Right, so if someone called the consent calendar, and Marcia wanted to say, item C on the consent calendar, which those should be identified in the agenda underneath the consent calendar. So you would still list them separately. but when you vote on a consent calendar, you're voting on all of it. But if Marcia wanted to take item C off the consent calendar and discuss it or consider it separately, she would just tell Mark, I want item C separate. And so it would be consent calendar minus item C, vote, and then discuss and vote on item C. Does anyone have any questions about how that would work? So in order to do that, Marcia has had discussions with me prior to tonight's meeting about doing this. The board would need to amend its bylaws in order to incorporate a consent calendar. And we can do that if I get some direction from the board on whether this is something the board actually wants to do. You don't have to take a vote on it or anything tonight, but I can prepare language, draft language for amending the bylaws that could be presented at next month's meeting that you could all consider, and if you want to do it then, you could. And then I guess if you actually adopt the change, your first meeting with a consent calendar would be in May. But I mean, what I need from my perspective as a draftsman is just an idea of what exactly the board wants to see in the consent calendar. I will draft it in that way. If I screw it up or I leave something out or don't or throw something in that you don't want in there, you can always make those changes before you pass the or change the bylaws. So.
And it would have to be on next month's agenda for us to take action.
Right, in order to change the bylaws, you have to have it, well, I mean, in order to do anything final, you have to have it on the agenda, but certainly with respect to changing the bylaws.
Well, my thoughts are on it. I'm not sure if it's really gonna give us much of a benefit if the goal is to streamline the time frame. And the reason I say that is we've just recently made the decision to do approval of a cluster of items as a group, and then we're also doing a, voice vote without taking a roll call on items that we need to approve. So those things there, I think, cut down our time, because if you take that off the table, we've only got, basically the financial expenditures and division report. We got a pretty narrow line there as far from a time, in my mind, from a time standpoint. So I'm not necessarily opposed to the idea, but I don't know if it's really going to benefit us that much as far as shaving that much time off. Because I can anticipate, like, for example, normally there's not a lot of questions about the financial report and expenditures, and we spent several minutes because you had some specific questions tonight on certain items on the topic. So I don't know that it'll be beneficial. I can see somebody's going to have a question on something every month on a certain topic that's covered between meeting minutes and get down to old business, where I don't know. That's just my thinking on it. I'm not opposed to the idea, but I think we're going to end up walking this back. And
The thing is,
we're going
we
to
can
get
always,
things out of order.
like you said, we can always walk it back.
Right.
I said, why not try it? See, just like.
Like I said, I'm not opposed to the idea. My thinking is, you got a question on the financial report. He's got a question on the expenditures. We got something about a grant. We got a question on the visitor report. Before you know it, we basically have melted this back down to where we're at right now.
Which would be what we would have done anyway.
Right.
But if we had a night that it wasn't like that, we could save quite a bit of time.
Yeah, and that's what I'm saying. I'm not opposed to
We
the
can always
idea.
go back.
I'm looking
I
at both
like the
sides of this.
flexibility of it myself.
Yeah, I'm just looking at both sides of it, so. But, if it's the pleasure of the board to move forward with that, then we can work on getting some language put together per Mike to put on the agenda for next month for discussion and a vote. So,
In terms of some direction for drafting, based on what the county board has and what I heard Marcia say a moment ago, the things that I would anticipate including would be approval of agenda topics, approval of minutes, communications, presentation and acceptance of financial report, review and approval of department expenditures, grant applications for review and approval, and department division reports.
Basically, it'll just require staff to do a little more detail. I mean, if we had like grants, for example, they'd have to like spell those out as a line item, right? Then they had some grants that we needed to know about specifically.
I'm not sure I'd be able to say. I don't know what they submit to you in the packets when grants are being.
I'm just saying, if you have something that has to be approved, it's got to be spelled out. We just can't put grants.
It wouldn't appear that way on the agenda.
Right, that's what I'm saying.
Right,
Okay.
it would be in your packet, but
Right.
on the agenda, it would just be listed with, again, the generic, I mean, it wouldn't be generic in the sense that it can apply to anything, but it would list the name of the grant that the board would be considering and approving.
That's standard form that they use to get us
Yeah.
information.
The packet would be a lot more explanatory, but the agenda itself would just be very
Yeah, okay.
general.
Okay, anybody else got any thoughts on that?
I just have a question. Mike, did you say you were going all the way down to department and division reports or employee recognition?
I did not circle employee recognition just because my assumption is that there's a point for that to be there on its own.
And that was gonna be the
And
concern I
putting it on
brought
the
up.
consent agenda would, I think defeat the purpose of having it on the agenda in the first place.
Correct.
So I did not circle that.
All right, thank you. And that was the point I wanted to bring up, is
Okay.
that, I mean, I realize that you guys may think it's silly to go, oh, so-and-so's here for 1 year.
It's not silly at
But
all.
the staff need to make sure that they hear that and they hear the recognition of their name.
I think before taking it off the consent calendar, it would just be taken off the calendar. I mean, if the board didn't want to do that, then I don't think they would do it, is the thing. But that has never been my understanding of the desire.
And you don't always have that every month.
Right.
Also, as a point. Okay, well, then,
I will have
guess
something.
we'll wait for you to draft something and we'll put that on the agenda for discussion and action next month then.
I'll draft it. I will send that out via writing. I'll send it to Lindsay, who can send it out to the rest of the board, so that you'll have it to look at before the meeting. And then, according to the bylaws, in order to amend the bylaws, you just have to have a 2/3 vote.
And I have one more quick question, Mr. Baggett. We have to have the agenda out, what, 2 weeks prior?
2 days.
2 days.
48 hours. And it's not really 2 days, it's literally 48 hours.
Okay, so we can't change the agenda topics once it's been posted, so why do we vote to approve the agenda topic?
I've always had that question myself. It's historic practice. It's because we've always done it. This is why we do it. I don't know that that's a good reason to do anything. I never counsel people to use that as a foundation, but at the same time, there are battles you want to have and battles you don't care to have, and this has not been something I've been willing to die on a hill for, so. But no, approval of agenda topics, you can remove things from an agenda, I suppose, but under the law, you cannot add things to an agenda once you arrive at the meeting. If it hasn't been published 48 hours in advance, you can't legally take final action on something.
You can
So
discuss things, but you can't take action.
you can discuss anything you want forever and ever, but you can't
Okay.
vote on it.
And to your point about that, so example, the item you've just brought up now, that would have probably been something we want to put at the beginning there on agenda topics to say, hey, I have an item that I want to add to the agenda as a discussion, you know what I'm saying?
You don't have to do that, though.
No, you don't have to do that. I'm not saying you have the ability to do that at that point at the beginning of the meeting if you choose to do so.
Oh, okay.
Well, while we're on the topic, because again, this is something Marcia has brought up to me, and I didn't think to say anything before, but if I'm drafting a change to the way that the agendas are drafted for the bylaws, does the board care to have that included on the consent calendar, or do you want to remove the approval of agenda topics entirely from future agendas? Removal is, I mean, it doesn't, I don't have a personal opinion, but, you know, I just want to make sure.
Well, it's kind of redundant in that though, that we send the agenda out in advance and then we're gonna approve it at the beginning of the meeting because.
Yeah, I think so, but, again,
That's my point.
it's not my job.
I don't
it's not
want
my
to break
job to tell
tradition
you
or
how to do
anything
it
here, but
necessarily.
Mr. Baggett, can you please draft the wording for us to remove that?
I'll
To see if it'll pass vote at our next meeting.
I'll just take that out. Okay.
Okay, moving on then.
Thank you, Mr. Chairman.
You're welcome. Interpublic Health Administrator update.
Okay, so I've kind of already updated you guys on some things. We, like I mentioned, are working on this COVID-19 vaccination grant, and this is going to basically just continue the COVID-19 vaccination efforts and also assist with monkeypox, influenza, and other recommended vaccination efforts within the community. So we're working on that, and we'll give you guys an update next month on getting those funds. We also did attend the job fair on the 14th, I believe, of March. So we did get some applications, and it was a well-received event. There was a lot of people there. There was a lot of companies and agencies and a lot of potential applicants that came through. I think the biggest barrier was just that people don't want to stand there and actually fill out an application and bend over on the table, and that's just my personal opinion. So a lot of people took applications, but we haven't received a ton back at this point. But we did receive some resumes, and the people that we do intend to call, some of those have been, distributed to different divisions in the agency as well for them to look into. So I'm hopeful that it was a positive thing, and that we'll potentially get some good applicants from that.
How was the food?
I didn't eat it. I came for the afternoon shift, so I kind of caught the end of lunch. But I heard it was good from the girls that were there in the morning.
It was enjoyable working with the gals and the staff at the conference center.
Gee, we wouldn't know if it was good or not.
Okay, anything else?
We just updated our current room. Cater Building Commission came in and finished that project. So they put new flooring in and trim and painted, and it's looking really nice. So it's just a nice update to our building that was much, much needed. While I was cleaning out that room, I found policies from 1992. So that was interesting to look through, and pay grade scales and all sorts of things that have been living in that room for a long time. So that project is in route and should be completed here shortly. And then we are also working with a kind of an online training company, and it's called HSI, and it's kind of an online training platform that we can provide health equity trainings and things like that. So that should be kicking off here in the next month or so. Hopefully in the next month or so, that will allow our staff to access a very large library of short, kind of quick, effective trainings, is the way that they've advertised it to us. And that was something we were able to complete through some COVID funding that we've received. So we're excited to bring that forward for our staff, just to provide more ongoing education and training opportunities for those people, for our employees. And then we're just paying for it through the end of 2023. So it won't re-up unless we chose to include it in the budget. And that is really it. And of course, as always, I welcome any questions if you guys need updates about anything else going on in the health department.
You might as well roll right into the next item on the
I guess
agenda,
that's
because
me too,
that's
right?
yours too, so.
So some updates regarding just, certain positions, the accountant and the emergency preparedness. I kind of touched on the emergency preparedness and that we're changing the job qualifications, which is okay per the grant requirements. It will require a pay grade scale adjustment as well, because we're taking away the bachelor's degree requirement. So that is in process, and we need to, I'm gonna get that sent over to you guys tomorrow. It's on my list now to approve that, and once that's approved, we'll get that posted.
I have it, the one that I sent to you still required a bachelor, so it was gonna remain a level 9.
I thought we were taking out, oh, okay.
No.
So,
Because of the actual job requirements and job duties that they have to do, I don't think we're already having enough problem finding somebody to fill a level 9 with it. I don't think if you say you're gonna offer less money, we're gonna have anybody apply for it. So yeah, we were just, instead of saying that it was a specific bachelor's, we were gonna go like a generalized bachelor's, like a bachelor's in public health or health-related field.
Well, I think the concern was whether we would be able to find somebody with a degree.
Well, and I think that the way that it's written now is a very specific degree with specific experience, whereas if we make it more of a generalized bachelor's degree, we might be able to get more, and I did send it over, or up to ISU, not the newest one, because it hasn't been voted on, but I did send it up to a professor up at ISU for some graduates.
You don't think you're gonna get more applicants if you don't have the bachelor's degree stipulation in there?
I think offering it at a level 7 pay, we're not gonna get anybody that'll stay.
You're gonna have people in the community that meet the requirements all but that bachelor's degree with experience.
Yes and no. I know that when some of the firefighters that I've spoken with that have asked me about, is this something that we could possibly do part-time or whatnot, when I tell them our pay, they laugh at it. And they said, we won't do it part-time even with that.
You must be talking to different ones than that I've talked to, because there's people out there interested. They just don't have the bachelor's, but they've got 20, 25 years in writing grants.
I don't disagree with that, but from those that I spoke to for the actual duties of this job and the requirements of this job, I think lowering it down a level or 2 levels and lowering the pay might even be more difficult to fill.
So may I ask one question? Why is the pay tied into a degree? If we feel this is a job, you know what I'm saying? Who ties us into that this pay, I'm sorry, but if I wanted to be a level 8 or a 9, and I know that there are certain requirements that this person must do, they must have all of these certifications, they must, have experience in that. Are we the ones that have tied ourselves into it, or has it countywide been?
Well, I don't know if it's countywide. I just know from here, like a level 8 and above requires some type of bachelor's or license, like an RN degree or something to that 8 and above.
So certifications needed would need that requirement.
The pay grade scale that it says it was approved at Board of Health meeting on August 16th of 2022. It, gives each pay grade and then it provides like education and experience required. So like for a level 8, it says 4-year degree or equivalent or registered nurse RN with associate degree or equivalent work experience. So I guess it actually
says
or
equivalent
work experience.
Yes.
So this might be an exception. There are some level 8 positions that require a registered nurse or a social worker because of grant requirements.
Right.
But this could potentially be a position that could be altered due to the fact that the grant doesn't have an educational requirement. And our pay grade scale does say or equivalent work experience.
So what's equivalent work experience? So is that also 4 years, or is that 10 years or 20 years?
Yeah.
That's something that probably needs to be a little bit better defined.
Mr. Chairman, I would make the motion that the Personnel Committee and Lindsay discuss it at the next Personnel Committee meeting and work this out.
Yeah, the bachelor's degree don't make no sense.
No.
Well, the experience, I mean, I know a lot of people that may not have college degrees, but they've got a lot of years' experience, and at the end of the day, if you want somebody that's got experience that can
That's right.
react and respond in a manner, especially with what this part of what the role and responsibility of this position is, when you want somebody that's out of college in 4 years,
Yeah, I mean, more
degree and
experience.
no experience.
more experience is better than degrees. I mean, that's how
When
we're
it
saying
comes to a mass incident, absolutely.
So let's say, Kathy, if that wasn't on the table, that you had to have some type of a 4-year degree, does that open the doors up for more people to apply for that job then?
I would hope so, yeah.
Yeah, that was the logic that we discussed before, that was kind of, I think the
I
reason
do request that I be present
making that
during that
change.
personnel committee meeting, just because I am familiar with the grant.
But I thought there were no grants.
tied to
No,
it.
but just knowing what the grant does entail with what our deliverables are going to be, to make sure that we're not just doing such a general statement that we're gonna hurt ourselves on the back end of it.
So this potentially could be a level 8 position and not a level 7.
Yes,
Is that
per
correct?
our
way to
pay grade scale, we could remain it as a level 8 position, because it does say or equivalent work experience.
And you have the discretion what that base is when you hire somebody in that range, right?
Yes.
So I can get a little bit of latitude there. I'd like to see it move forward without the requirement in there, 'cause I think you're gonna miss out a lot of good people.
I would agree.
I would agree.
And I can tell you, I think Susan's maybe only sent me 2 or 3 for that position. And I really figured or thought that with a lot of the 81 employees, that they maybe had some of those degrees, like a bachelor's, where we could, train, and we didn't get anybody for that position.
Okay, so you're gonna develop that posting and then send that to us based on what we're discussing right now?
Yes.
Okay,
Yes, I
we're all in agreement about that. Okay. All right, okay, thanks.
Oh, so yeah, we'll get that completed. And
What about the county? Before you go with that?
so we have extended an offer to an internal person, and they will be resuming that position effective Monday.
Oh,
Okay,
wonderful.
and is Lakia okay with
Mhm.
the person you
I'm
chose?
okay with it.
All right, good deal.
I'm sure
Want
you're
everybody-
part of it.
want-
Yeah, I was
I want to see everybody working together, so that input's valuable. Okay, thank you. Anything else then? Those two, okay. Discussion update regarding public health administrator applications submitted to date. So, for the sake of information for the rest of the board, the personnel committee met roughly about 2 weeks ago. We went through a pretty extensive amount of applications, and we basically reviewed each application individually based on a number of factors. And we have eliminated that down to a very, very small group of individuals that we are going to try to get scheduled for a interview. And I would like to see us get that done sometime here in the next couple of weeks, if everybody's schedule's permissible for the personnel committee. I've looked at a couple different dates myself that I know I'm gonna be available, but we can either discuss that now, or I can send you guys out an email individually for the personnel committee of some optional dates. I'd like to try to get a response back from everybody on that by the end of this week. So we can extend a courtesy to the individuals that we want to contact for interviews and tell them this is the date that we're gonna conduct the interviews, and hopefully they're gonna be able to make their arrangements to be available for that process on that date. The goal is to get the interviews done so then we can come back to the entire board at next month's meeting with discussion, recommendation, and hopefully action to hire a PHA if it so is warranted based on our final interviews. So just for informational purposes, for us, the board, to kind of get you guys up to speed where we're at. And we had a lot of people apply, but we had a lot of them either didn't meet the education requirements or didn't have the background that we were looking for in terms of their credentials or experience. And they were from all over the place. We had people from all over, literally all over the country that applied. So we did get a good response. We probably had what, 25, 30 applicants. We had quite a few. Some of them didn't follow directions, and they sent stuff to Susan instead of sending it the way we asked them to send it, but that's okay. So that's where we're at with that, and I think that the benefit of getting the decision made will be timely. It will also give the rest of the organization, the staff, some assurances that the board has reacted in a timely and responsible manner, vetting candidates and making a choice. And we'll go from there, and we'll discuss that in more detail next month for closed session. We'll go over that stuff, more specific detail with candidates that we have interviewed, and what the personnel committee's recommendation might be at that time. And welcome the rest of the board, anybody that's interested in coming to that interview process to attend. And then also we will try to provide as much information as we can about the final candidates for consideration at the board meeting next month. So that's where we're at with that. Discussion action of election of officers, we did that last month, that was done. And discussion action regarding nominations for appointments to committees. I've been kind of waiting and I've had about half the board has responded to me about committees that they would like to serve on. I know Debbie is not here tonight, but she hasn't given me an indication what she would want to be involved with. So I will open the floor for any board members that are interested in any of those specific committees. Right now, I have myself on Personnel Committee, Finance, Andy on Personnel and Finance, Marcia on Personnel, Jeff on Finance and Personnel, and then Carolyn on Personnel. And otherwise, the floor is open for anybody that's interested in a specific committee, whether it be bylaws, nominating committee.
You have any bylaws?
Yeah, she's on bylaws.
Okay, you wanted to do bylaws also?
Yeah.
Okay, all right, okay.
For the record, you don't actually have a bylaws committee. It can be an ad hoc committee for when you want to do something, but it's not a standing committee in the sense that it has a regular schedule or a
Okay.
regular list of activities.
So you have any that in
For personnel, yeah,
Your only standing committees are finance, personnel, and nominating.
right.
Well, bylaws isn't ad hoc.
Mark, I'd be happy to be on any committee that you might feel that my background would best help. So whether it's nominating or personnel or bylaws or.
That would be much appreciated, Dr. Smith. I will put you on the nominating committee. Right, and that's what I was gonna ask, if you still want to do that or not. Dr. Jerger, you have any pleasures that you'd like to serve on?
Probably nominating.
Okay. So we have right now on finance, we got Jeff, you, me, Candy.
Stephanie on my agenda.
No.
What's that? Sorry.
I probably won't let Diane.
I moved it. Oh, it's on the other side of the sheet, so I'm using it for my notes.
Debbie Hill's not on a committee right now.
Yeah, Debbie's not, so I will ask her. We actually have people on bylaws committee. That's what I was thinking we did have. And we've got Dr. Manny Gutties on there. So, and that can be an ad hoc committee, as Mike had pointed out, and I think that's important to have to review that.
The only other note I would make is looking at the bylaws, you can have as many members as you feel is appropriate on the finance and personnel committees, but nominating is actually specified in the bylaws to only have 3 members.
Okay, and that's what we have right now.
That is a limitation on how many can be there.
And you have
So,
many,
and it's best to have active members being on the nominating committee.
so who you take on, who are you?
Jan, says Jan Axelmer, I'm on there. Do you wanna,
So Dr.
Sure, you put in-
Jerry was going to be on here.
or you wanna put Debbie on that and take,
Oh,
you can
Dr.
talk to me on
Manigotti's
that
gonna come
one.
off, Dr. Manigotti's gonna come off the nominating committee because I have concerns about his attendance and I don't want somebody making nominations that doesn't attend the meetings frequently enough to be in the loop with what's going on.
Okay. So who you putting on? He has played.
Jan, Brett,
I just
Dr.
said,
Jerger,
Cody,
Cody.
Dr. Gerger, and Dr. Smith. So that's your 3 for that. And we can have for as Mike pointed out, for the ad hoc committee, I still think we need to have a bylaws committee. Do we have a limitation on that, like for people?
No. The nominating committee is the only one that you have any type of limitation.
Okay. We'll have to discuss that further.
Okay.
Because her term is coming up also, so I want to make sure she had indicated she was planning on wanting to stay on, so. But we'll finalize the committee assignments by next month. I'll have those, so if anybody has something they're interested in between now and then. But I think we've got a lot of these slots filled at this point. And you can serve on more than one committee, so, you know, I don't know, Dr. Smith, if your cup of tea is finance numbers at all, if that's something that interests you or not.
Not especially.
Okay. As long as you got checks, you got money, right? Just keep writing the checks. So, okay, we will keep working towards that and get that list of assignments finalized for next month's meeting. Okay, we don't have any closed session items this month. So anything else for the good of the cause, anybody wants to bring up at all?
I was just gonna say that, moving forward, I'll just email all of the Board of Health members and, request that if you want something added to the agenda, just to, basically the same way that like the county board does it, and that's just a tip I'm taking from Crystal. But so I'll start emailing you guys in advance, that way if you want me to add something to the agenda, you can let me know, so. That was all.
Okay.
I have a question, just to kick back to the ambulance thing, because it caught me so off guard yesterday. Who supervises their service here in the community?
Nobody.
Yes,
How's that for your
they've got supervisors.
They have their own internal people. I think Dr. Smith's asking who's
I
overseeing
mean, from the
that.
community that would oversee and.
The city.
They don't call back. If you call their office and make a complaint, which we have 3 times now or 4 about them going to the intersection with no lights or sirens on, this happened to our service guys 3 times where they've almost got hit. I mean, literally, no lights, no sirens, and the guys that's called, had the time and the exact intersection. The guy that runs the office calls back and says, we know where they was at, and we'll make a record of it. That's all they say. And this has happened 3 times to our company, and I know it's other people's talked about it also. The guys drive terrible. If you make a complaint, the one guy calls back, he'll talk to you, but.
You've got Jeff Ellis, Doug Welton, and.
Doug's who called us back.
Yes, Doug Welton's the operations manager,
But they're.
and Larry Landris.
It's kind of a scary situation with their record right now.
Well, but the city who issues their license to operate, I won't say if they're their oversight, but that's who they answer to. And then they've got their company, their headquarters where the dispatch in St. Louis is.
Right. Yeah.
Yeah.
Yeah, I mean, I had a heart attack 2 years ago, right after COVID vaccine. I'm terrified that, there'll be a lot of people dying because of service that's substandard.
Well, the reason Mount Zion's trying to get that in is they've had they've waited their 20, 30 minutes for a unit out of Decatur and they don't show, so they have Central Dispatch Center, Fire Dispatch, Page, Bethany, and Pray Bethany has an extra crew in town. And then they wait another 20 minutes for that crew to get to the ambulance bay in Bethany and drive over to Mount Zion.
If you live on the county line like us, even near the county line, if you call 911, which one of our neighbors just did, they will not show up. You're in limbo. They say, call Christian County, and you tell them, I live in Macon County. Well, your address shows up like mine in Christian County. They will not show up. They will not come out.
If you live down on Helvetti Road,
They
you're into that.
send Taylorville, which is 30 minutes away.
Yeah.
And they don't show up.
And it's getting bad enough, but so part of that conversation last week, Bethany's actually looking to add on to their building to put a second ambulance on their department. And you look at the size that Bethany is as a
They've already
community.
got 2 ambulances. It'll
And
be their third.
yeah, you look at what they're doing down there in that small community, that shows you how bad it is. And I know, having served on Mount Zion for 14 years and having talked to the guys on the department now, they're angst up. And I can tell you, I mean, I told a story the other night that I went out call many, many years ago. We were doing a training fire and I ended up responding to a 6-vehicle, 12-person MVA on Dalton City Blacktop by myself, knowing that it was gonna be at least 10 to 15 minutes before the guys got their stuff together and got out their trucks. We were 45 minutes then waiting on DAS. They had to have 6 ambulances show up. We're in trouble. I tell you, from an emergency service standpoint, we're in trouble in this county because there's no accountability for these people. They have no contractual agreement with the city. I just found that out last week. They have no contractual agreement with the city of Decatur. They can have a bean counter, be looking at our numbers. They'll probably make the decision, honestly, probably by fall, because they're only committed to be here for a year. Is their licensing agreement right now? They may look at it and say, we're not making any money in Decatur, Illinois. We're packing up our marbles and we're going home. And we could be without an ambulance service
But there's
in the next 6
also,
months.
there's also the nationwide shortage of paramedics.
Yeah. But Hickory Point's getting ready to do it. I think they've actually already voted on it. They've already passed it by a very, very slim margin. They're gonna start their own ambulance service in Forsyth. So I fear that you're gonna start seeing other departments are gonna do this out of necessity, not necessarily because they want to. But you're right. I know Mount Zion had an accident one day with Long Creek at Lost Bridge in 121. And it's 45 minutes to get an ambulance there for MVA. It's not good.
With the Decatur ambulance bay or dorm sitting right there at Baltimore and Lost Bridge, but the ambulance was never in.
But you know what they told us the other night? 5 days out of the month of February, so 5 days out of 30 days, they didn't even have staff stationed at post 3. So that's 25, I didn't tell you that, 25%, I hadn't told you before now, 25% of the month, they didn't have the staff even at post 3, which means, you guys understand, that's at Lost Bridge in Baltimore is where that house is at. That means all of Long Creek, all of Mount Zion, and the southeast side, basically Decatur,
All the way to Cerro
totally unprotected. And I asked the guy, I said, where are you guys gonna come from? He said, Wood Street. I said, how long is that gonna take? He said, oh, it's gonna take us at least 15, 20 minutes. That's if they're in post and not out on a transfer or out on another run. We're, I tell you what, from an EMS standpoint, we're in real serious trouble here.
That post covers Oakley to Cerro Gordo.
And they had a dispatcher, they had a real good team there. They had a dispatcher there from 911. And he had all login times for response time by the ambulance and from the fire department. And if the fire department ends up putting their own ambulance service in, you're talking about response times well under 5 minutes. Right now, these guys' response time average was like 11 or 12 minutes, and that's if they're in post. So I feel for you guys in the medical field, what you're gonna be dealing with emergencies down the road. It's gonna get bad. And to hear you tell a story about not being able to get from your building, which I know where your office is at, to DMH right next door, I would have had him in a wheelchair and pulled him around the corner.
You don't want that liability.
I know, but I understand that, but somebody's life's at risk. You gotta make a hard decision there, and deal with the legalities of it down the road. But this is what I was talking about earlier. I think the health department can take a little bit of a lead somewhat, at least for the sake of conversation. We'll dump this in Marissa's lap and let her do a really good PR campaign about how we can help the county out, because this is something that we all should be talking about. The whole mental health issues, the emergency medical services, the paramedics, the ambulance, available. We got a lot of problems in front of us right now to contend with. And I'm hoping we can start having some conversations going forward with other people in the community, because it's gonna put somebody's life at risk. Somebody will die over this before something gets done. And I know that I'm saying that from personal experience, because you go out 2 o'clock in the morning, and you're doing CPR on somebody, and you're 45 minutes to the hospital.
That's why Lucas devices.
It's frightening, it's frightening.
You're gonna wear out.
So, anyway, all right, thanks everybody.
Motion to adjourn, Mr. Chairman. adjourn?
We already adjourned.